So in our discussion about the metoclopramide, we will cover topics including its mechanism of action, its therapeutic uses, adverse effects, drug-to-drug interactions, and contraindications. So the metoclopramide work as anti-emetic, and anti-emetic means anti-nausea and vomiting. So the metoclopramide work to prevent the nausea and vomiting from occurring, and that is by antagonizing the central dopamine D2 receptors in the chemoreceptor trigger zone, which is apart from the medulla oblongata of the brainstem. Now the chemoreceptor trigger zone is linked to the vomiting center, so once the dopamine D2 receptors are antagonized in the chemoreceptor trigger zone, this will lead to the inhibition of the vomiting center, and this would give us inhibition of the nausea and vomiting triggered by most stimuli. Now at high doses, the metoclopramide also antagonizes the serotonin 5-HT3 receptors, which also contribute to its anti-emetic effect. Now metoclopramide also work as a prokinetic medication, and prokinetic means drug that enhance the motility of the upper gastrointestinal tract, meaning metoclopramide accelerates the motility of the esophagus and the stomach. And the metoclopramide achieves that by blocking the peripheral dopamine D2 receptors in the esophagus and in the stomach, and this will lead to increasing the amplitude and the duration of the esophageal contractions, and this also increases the tone of the lower esophageal sphincter and relaxes the pyloric sphincter and duodenal bulb. And all of these effects would accelerate the food motility through the upper gastrointestinal tract, leading to faster stomach emptying. So now the metoclopramide blocks both the central and peripheral dopamine D2 receptors. Now the metoclopramide also work to increase the muscarinic activation, which also lead to increase the gastrointestinal motility, and the metoclopramide also work as a serotonin 5-HT4 receptor agonist, which also lead to increase in the gastrointestinal motility, and this would also help in its prokinetic effect. So now the metoclopramide work as an agonist for the serotonin 5-HT4 receptor, and it work as an antagonist for the serotonin 5-HT3 receptor. And the 5-HT4 help in the gastric motility, while the 5-HT3 helps in the anti-emetic effect. Now the metoclopramide prokinetic effect also contribute to its anti-emetic effect. So by enhancing the motility of the gastrointestinal tract, this would also help in preventing the vomiting because there is no food left to vomit. Now let's talk about the therapeutic uses of the metoclopramide. So this medication is FDA approved for treatment of the gastroesophageal reflux disease in patients who fail to respond to the first-line treatment of GERD. So for patients who fail to respond to the lifestyle modifications and to the proton pump inhibitor treatment. And metoclopramide utilizes its prokinetic effect in treatment of GERD. Now this medication is also FDA approved for treatment of nausea and vomiting in diabetic gastroparesis, and the IV formula of this medication is also FDA approved for treatment of nausea and vomiting in chemotherapy patients. Now, metoclopramide is used off-label in prophylactic prevention of nausea and vomiting in post-operative patients when nasogastric suctioning is contraindicated or unavailable. Now, it is also used off-label in treatment of nausea and vomiting and reduction of headache intensity in acute migraine attacks in emergency settings, and it is used in treatment of nausea and vomiting in hyperemesis gravidarum, which is a condition that happens in pregnant patients when they have repeated vomiting, and according to the American College of Obstetricians and Gynecologists, this medication is indicated for refractory cases only because it can cross the placenta and lead to methemoglobinemia and extrapyramidal signs in neonates. Now, it is also used off-label in treatment of nausea and vomiting in critically ill advanced liver disease patients, and it is used in treatment of diamond blackfin anemia, and the metoclopramide is hypothesized to stimulate the erythropoiesis in patients with diamond blackfin anemia through induction of prolactin release in these patients. Now let's talk about the pharmacokinetics. So this medication is available as oral, rectal, intraperitoneal, nasal spray, intramuscular, and intravenous formulations, and the last two options, the intramuscular and the intravenous, are reserved for severe cases. Now, the nasal spray formula is used more in diabetic patients for treatment of diabetic gastroparesis, and the intraperitoneal route is used for patients undergoing peritoneal dialysis. Now, the oral formulation is well absorbed with peak plasma concentration reached after 1 to 2 hours of the oral administration, and the half-life for this medication is from 4.5 to 9 hours, and it is metabolized by the cytochrome B2D6, and it is also metabolized by the glucuronidation and the sulfate conjugation, and it is excreted through urine. Now let's talk about the adverse effects. So metoclopramide may lead to extrapyramidal side effects, and that is due to the central blocking of the dopamine D2 receptors, and the extrapyramidal symptoms include tremor, which is shaking movement. It also includes rigidity, which is resistance to passive movement, and dystonia, which is sustained muscle contraction, and dystonia is the most common drug-induced movement disorder. And then we have the akathisia, which is inability to remain still, and we also have the dyskinesia, which is involuntary repetitive muscle movement that occur with long-term treatment with this medication, and that is why metoclopramide is advised to be used for less than 12 weeks to prevent the dyskinesia from developing. Now, metoclopramide may also lead to hyperprolactinemia, and this is caused by the central dopamine D2 receptor blockade, because remember, the prolactin and the dopamine have an inverse relationship. So if we have lower dopamine levels in the brain, we have higher prolactin levels. And if we have higher dopamine levels, we have lower prolactin levels. And in this case, we have blocked the dopamine D2 receptors, and this means that we have hyperprolactinemia. And hyperprolactinemia may present as gynecomastia, galactorrhea, amenorrhea, impotence, and hypogonadism. Now also, metoclopramide may lead to neuroleptic malignant syndrome, and the neuroleptic malignant syndrome present as autonomic disturbance in form of muscle rigidity, hyperthermia, high blood pressure, sweating, and myoglobinemia. And this is a serious complication with a 20% mortality rate. And to treat this, the drug should be discontinued, and dantrolene, which is a medication that helps to relax muscles, and other supportive therapy is administered to treat the patient. Now, another side effect is that in patients with glucose 6-phosphate dehydrogenase deficiency, or in nicotinamide adenine dinucleotide cytochrome B5 reductase deficiency, the metoclopramide can cause methemoglobinemia and self-hemoglobinemia because this medication increases the oxidative stress, which is dangerous in patients with these conditions. Now also in the adverse effects, the metoclopramide can increase the serum aldosterone level, leading to fluid retention and volume overload due to the activation of the renin-angiotensin-aldosterone system by the metoclopramide. And this is harmful in patients with heart failure or liver disease. Now also in the adverse effects, the metoclopramide may lead to development of purpuric rash not related to thrombocytopenia, and this rash would subside once the drug is discontinued. And the metoclopramide may lead to laxative effect in addition to its prokinetic effect, leading to diarrhea, because remember the laxative effect leads to diarrhea, and this is less common and occur mostly in children. And the metoclopramide may affect the mood and lead to psychiatric adverse effects, and that is because of its antagonist effect on the serotonin 5-HT3 receptors and agonist effect on the serotonin 5-HT4 receptors. And this may lead to the patient being agitated, or it may lead to irritability, abnormal behaviors, panic disorders, major depressive disorder, and agoraphobia. And all of these side effects are rare. Now let's talk about the metoclopramide drug-to-drug interactions. So this medication, if concurrently administered with dopamine agonist medications like the bromocriptine and the cabergoline, this would lead to reduced efficacy of these medications because metoclopramide blocks the dopamine receptors while these medications activate the dopamine receptors. And also, concurrent administration of metoclopramide with antipsychotic drugs should be avoided because both lead to dopamine receptor blockage, and this would lead to additive effects and side effects. And especially these patients are high risk for a neuroleptic malignant syndrome. Now also the efficacy of the metoclopramide is reduced if it is taken with anticholinergic drugs or opioids, because the anticholinergics and the opioids slow the gastric emptying, while the metoclopramide accelerates the gastric emptying. Now also in the drug-to-drug interactions, the oral metoclopramide increases the serum aspirin levels due to increased absorption of aspirin, and this may lead to salicylate toxicity. And same can happen with the bupropion and the cyclosporin medications. And the metoclopramide may decrease the absorption of some other drugs like the digoxin. And the metoclopramide shouldn't be used with the cytochrome B452D6 inhibitors, medications such as the fluoxetine, because this would inhibit metoclopramide metabolism and it would lead to higher drug levels and subsequently higher risk for side effects. Finally, let's talk about the contraindications. So metoclopramide is contraindicated in patients with history of hypersensitivity reactions to this medication, and it is contraindicated in suspected bowel obstruction or perforation and in gastrointestinal hemorrhage because it aggravates these conditions, and it is also contraindicated in patients with a clinical depression because this medication may aggravate depression due to its effect on the serotonin receptors that we already mentioned, and it is contraindicated in patients with seizure disorder because it lowers the seizure threshold, and it is contraindicated in Parkinson's disease patients because it blocks the central dopamine receptors and aggravates the Parkinson's disease, and it is contraindicated in patients with pheochromocytoma because it enhances the release of the catecholamines, and it may lead to hypertensive crisis in patients with pheochromocytoma. And this medication has a US FDA boxed warning, and it states that the metoclopramide can cause tardive dyskinesia, which is a serious movement disorder. Therefore, avoid treatment with this medication for longer than 12 weeks. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.